Welcome to AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Welcome to AARP, Arizona Hispanic Connection. Another very important subject today is called Healthcare. Stop the RX greed. Healthcare. Stop the RX greed. I don't know how it sounds to you out there, listening by radio or joining by Facebook Live. And again, if you are joining by radio, please remember that we do Facebook Lives on all our shows, and the videos eventually are loaded on the Facebook page. The Facebook page is AARP, Arizona Hispanic Connection. And we are asking you to join the page, follow the page, and share it with friends and families. We addressed a lot of good information, subjects, issues of importance to the community, to the state, and actually to the nation, believe it or not. So here we go again. The subject today is healthcare. Stop the RX greed. With us today, we have two special guests, very special, I might add. It's Lupe Solis, and Lupe Solis has been with us before. A little bit about Lupe. Lupe is the former advocacy director for AARP Arizona. She's retired. She's a community advocate. She's a mother. She's a grandmother. She's a friend, and currently a volunteer, not only for AARP, but for many, or I should say for several other organizations. Lupe, as always, thank you so very much for being with us.
Thank you for inviting me. It's a pleasure to be here.
How do you feel about this issue that we would like to address today?
I feel that it's all important. This is something that concerns families, not just for the older persons, but for the whole family. The cost of prescriptions is something that impacts families' budgets tremendously.
Definitely. And my friend Steve Jennings. Steve Jennings is the current advocacy director for AARP Arizona. And, you know, when it comes to this term, Steve, you and I have tried to explain this term advocacy, but it's almost like it's hard. It doesn't resonate that well. But anyway, it's an effort to work with legislators to convey the need of reject certain laws, pass certain laws, and what have you. So again, Steve, you have been with us several times, and thank you so much for making time to
Great
be with
to be
us.
here.
And again, this subject, I mean, you've been with AARP for many, many years. It seems like healthcare has been with us, and it will continue to be with us forever, it seems like. And this matter of prescription drug, has it always been with us for a long time?
Well, as drugs have become more and more what medicine is about, yes, it's a bigger issue than ever, especially the cost of them, David.
Definitely. You know, we have named this show Healthcare, Stop the RX Greed. And if somebody has never heard of the term RX, it simply means prescription drugs.
That's right.
And it's a pretty strong subject. And this subject, let me let the public know that it's the name of an AARP campaign. Stop the RX Greed. I mean, it's pretty strong. And I don't know. I just wanted to get the definition of greed. I think it is worthwhile. And this is what it says. Some of the dictionaries, some of the definitions is greed is an intense and selfish desire for something, especially wealth, power, or food. An inordinate or insatiable longing for material gain, be it food, money, status, or power. An inordinate desire to acquire or possess more than one needs.
That's quite a definition. I was
Amazing.
glad you didn't ask me to define it. I was trying to figure how I would say it. I'm glad they got food in there.
Yeah, so this word, this phrase that AARP is using is, Lupe, don't you would you agree with me that it's pretty strong, isn't it?
It's pretty strong, and I love it that they've decided to tackle this issue, because the cost of prescriptions, as you well know, has been growing sometimes incrementally to the point of overpassing the rates of inflation. And this means that people on fixed incomes, for example, have a hard time making do. And many have to make decisions between, do I eat or do I buy my prescription?
This is pretty crazy that in the United States, many people have to choose between buying the prescription drugs or eating. I mean, it is pretty crazy, isn't it?
Or taking care of other basic needs.
Right. One would not think that in the United States such a thing is happening, but it is happening. You know, let's start by saying a few positive things, because there is actually drugs, for the most part. I think most people agree that prescription drugs are an amazing, almost miraculous thing. People are living longer, and there are just medications. I want to get your feeling about, what's your take on prescription drugs? I assume that we all agree how great they are, correct, Steve?
Well, the average 65-year-old takes 4.5 prescription drugs now.
Wow.
And, they are the new form of medicine, and they really are miraculous. They're part of the reason lifespans have extended. And, it used to be you'd have operations and various, medicine was kind of mechanical, and it suddenly seems to have shifted into, you go to the doctor, they sit there working on the computer, putting in all your information, and then they write your prescription and you head to the pharmacy.
Right.
It's a wonderful thing, and we don't want to, mess up the research and development of new drugs.
Right. Your take, Lupe, on prescription drugs. Do you take any? Do you appreciate them? I mean, I'm sure you know people
actually,
too.
I have recently started taking some on a regular basis, and it's astounded me the cost of them, particularly because there seems to be a new practice amongst insurance companies wanting you to get not 1 month, but 3 months. Well, there are many people who cannot afford a copay of $120 upfront for 3 months of service.
Right.
But the fact that the medications are available, the fact that science has advanced as much as it has with all kinds of medical advances, prescriptions is a great part of it. And we are lucky to have that, because as Steve pointed out, years ago, you might have had a condition that just ran its course and there was no stopping it. And now there's a lot of chronic care that can be taken care
Wow.
of through these new medications.
Yeah. So we applaud, definitely. We are thankful, very thankful that researchers and scientists and all chemists and biologists,
Pharmaceutical
companies,
Yeah.
they give their focus and their lives to research and come up with new drugs. It's just that when it comes to the cost, we have some issues, and we will address those issues in this program, some of those at least. Before we go on our first break, let me just say that, prescription drugs help control chronic conditions. They treat the temporary conditions and overall long-term health and well-being, high blood pressure, diabetes, high levels of cholesterol, curing infections, relieving pain, anxiety, cancers, and Alzheimer's. I mean, there's just an amazing progress in prescription drugs, and this is something very positive and very great. However, when it comes to cost, something's not working out for many folks, and we will address those issues. Stay with us. You are listening to AARP, Arizona Hispanic Connection. We'll be right back.
AARP, Arizona Hispanic Connection. Educate. Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection. I don't know. I have to say this. I feel so good. Every time we address issues that are as important as this, it just gives you a good feeling that I think people need to understand how all these things work. Because a lot of times the cost may hit you and you may hate it, but it's important to understand what's behind everything, right? So I'm so happy to do these kinds of shows. You know, AARP Advocates, this is a Twitter account that AARP has, just tweeted something about an hour ago, and let me read that tweet. It says, more than 7 million Americans need insulin to survive. The cost has nearly tripled from 2002 to 2013. This is outrageous. Prescription drugs don't work if people can't afford them. This is a tweet from AARP Advocates, and it's very, very true. Let us continue, Lupe and Steve, talking about, when a drug or prescription drug hits the public, I assume there's it may even be years from the beginning of that drug. Can we say a little something about how that starts? How does a drug goes from the research part to the trials and then to the government regulatory body and then eventually reaches us, anyone?
Well, the companies themselves, the pharmaceutical companies, have a process they call research and development, and that basically takes years. And sometimes they're successful and sometimes they're not, and that's part of the cost that is then built into what ultimately one is going to pay for those medications. But once they do send it to market, they've been approved by the FDA. Otherwise, they cannot make market. And there is a certain number of years that their patent for that drug remains in effect, giving them pretty much the absolute right to be the only ones manufacturing that particular drug. It's when that patent has expired that they and others are able to generate what's known as a generic medication. That usually, and I know some of you might have gone from buying a drug that was still covered to one that's a generic drug, and you know the difference in price. It is considerable. It could go from $40 to $4 a month.
Brand name versus generic. Right. So I assume, so who are these pharmaceutical companies, Steve? Who are they? What do they do? What is their job? Because the problem seems to be them, in a sense. At least, recently there was a hearing in Congress, right? Who was convened?
Well, the companies you're talking about are some of the largest corporations in the world. And
say that again?
They're some of the largest corporations in the world.
In the world.
And, their job is to make money for their owners or their shareholders.
Okay.
And like every corporation, that's their job. And do they do it ethically or not, in the sense, do they do it fairly? And since they're producing these products that are not optional, I take a blood pressure medication. It's not optional if I take that or not. What is it fair for them to charge? I was in a pharmacy not too long ago picking up my drugs, and there was a man older than me picking up his, and he could not afford them. So the pharmacist took them back. He walked away with nothing in his hands.
Amazing.
And they were not optional.
You actually witnessed that.
Yeah, well,
Amazing.
That's going on.
Amazing.
And some people don't even bother to come because, Lupe used this term co-payment. Well, if you have insurance, and you better hope you do if you have to get RX drugs, prescriptions. I don't even know what my insurance company pays for the drug. I just know that I owe, if it's a brand name drug, I owe $50. And if it's a generic, I owe $20.
Right.
So I take 4 drugs. So each month I owe $140 every month.
So the very fact that Congress asked the representatives of, 6 or 7 companies, major pharmaceutical companies to basically participate in a hearing, that seems to be where the issue is, that where there could be a change. So Steve, so these companies actually hire researchers, I suppose, chemists, biologists, researchers to kind of come up with drugs. Is that the process?
It's a big part of their operation, yeah.
Okay.
Not the biggest part, but that's an ongoing thing, David. It isn't like they say, let's come up with one drug, we'll hire a bunch of people. Those people are permanently employed, and they have a number of drugs under research and development, like Lupe was talking about.
So once they come up with the drug, it goes to trials, I suppose?
There's trials. They may be on animals first, and then they may be on people.
Right.
And, they try and determine side effects and the effectiveness of the drug and the safety of the drug.
Once good, always good drugs?
Well,
is the
no,
question?
then they have to get government approval, and, that's a process. And as Lupe was saying, this can take years for a single drug, and it's often used as, justification for the high prices by the companies.
So basically, they say we need to charge these high prices because we spend way too much money on research and paying all the researchers, et cetera, et cetera.
Well, what they'd like to say is, we're only charging what it takes to keep doing research. If you don't want to have new drugs come on that are miraculous drugs, then you better not limit the amount of money we can charge. That's what they say.
Are they open in their books? I mean, do we know exactly what's going on, or it's pretty secret? Would you say?
Well. Right. It's not simple information. And of course, they report corporate operations to their shareholders and their board, but it's not required that they reveal them to the government. It's my understanding it's not. And that's one of the things AARP wants.
Wow. So, Lupe, who is the body of government that makes sure, that regulates, per se, the drugs?
Well, the approval of the drugs is the Food and Drug Administration, but you have to remember that there's many departments in government, including the Veterans Administration, including Medicare and Medicaid, programs that buy the drugs from these pharmaceutical companies. And so far, they have not been given the right to negotiate prices.
Medicare has not.
Medicare has not.
And we're going to get to that point because that's in the section of some of the options that are on the table to try to fix this problem. So you said that the federal, the Food and Drug Administration, and I actually went onto the website this morning, and for anybody out there, anytime you want to know anything about food and drug, there is a website. It's FDA.gov, FDA, and I know this is an acronym that many people use, FDA. Remember, FDA.gov, it's a great page to go to when it comes to all these kinds of issues. So we're saying that this is one, you could say, the approval piece is done by the by the Food and Drug Administration.
The Food and Drug Administration.
Yeah. Let's talk a little bit more for the remainder of this segment, Lupe and Steve, about this concept of brand and generics. So why are the brand name drugs so expensive, and what happens? Why, the process of when a generic drug can become available?
Well, and what you're referring to is that, as Lupe said, when they develop these drugs and they get to use their name, you'll see these commercials on TV, these researched names, and they're trying to get you to ask your doctor if you should take that drug. And it's a brand name drug, and they make more money on that for a number of years. No one else can offer it. But there's manufacturers that will research and make nearly identical drugs much more cheaply. Some of them are foreign, and those are called generics. And, I had my pharmacist call me the other day and say, well, you're paying $50 copayment on this medicine you're taking, and there's now a generic available, and the copayment will be $20. Do you want to switch the drug? And I said, well, go ahead and ask my doctor if that is okay to do based on my conditions. And then pretty quick, my doctor's assistant called me up and said, it would be okay for you to take the generic, so I'll save $30 a month.
So Can you explain again? I know, I think both of you mentioned it earlier, but what is the process by which a generic drug becomes available?
Well, there's a certain amount of time that the brand name, as Lupe was saying, has a patent, a protection of it as a product.
So the brand name drugs and the manufacturers of that drug, they have the right to
be the only
ones marketer of that drug until a certain number of years. I think
it may
years,
be
right?
it may be the only drug that treats that condition.
And these are years. We're not talking about months, but
these are years. Yeah, and that's been debated in Congress how long that should be.
So for those number of years, let's say is what any number 5, 10 years, perhaps.
I think it's more like 12 or 13.
Okay, let's say 12 years. So for 12 years, no generic drug can be produced until there's been 12 years of that brand name drugs haven't been made.
That's right.
Supposedly based on the fact that that's how long it takes them to recover the cost of the process to bring this drug to market. However, what Steve was saying, other companies have managed to imitate, if you will, almost to the T, the same product. You will find this in many products, not just in prescriptions, but when you go to the market, depending on which store you go to, please notice that you will have a brand name and then you will have the house brand. Identical stuff being sold for a lot less because it's under the brand name or the house name. That's the same way that it works with medications.
So could we say that there's that there in that very area there's room for making changes to make the situation better, especially with the cost of drugs?
Yes, and it varies by country, David.
Okay.
The patent law applies to the United States, which is 12 or 13 years on these drugs, but in other countries it's much shorter.
I see.
However, most of these pharmaceutical companies, the major ones, are international companies. They're global companies. They're not just here. You may go, for example, to Mexico, as I have done sometimes, and bought something, not as much as it used to be available, where you could sometimes buy even antibiotics off the counter, not anymore. But you will notice the packaging, and it is done by the American companies, or at least the international companies.
Right.
So it's the same drug.
Wow. Okay, so
same.
Transparency is a big deal here, as I hear you, and then the issue of the generic being available sooner might be another issue, and we will get to the possible solutions or things that are being discussed, things on the table to bring more the prices of prescription drugs under control. We have to go on our second break. Stay with us. This is AARP, Arizona Hispanic Connection. We'll be right back.
Celebrate. Connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP, Arizona Hispanic Connection, a platform that seeks to educate, to celebrate, and to connect communities in Phoenix and in the whole country. Facebook Live or Facebook allows us, or the internet for that matter, allows us to reach pretty much everyone in the whole world if they wanted to join the Facebook or our Facebook page. Thank you so much again. Let's continue with the subject. I have a comment from someone on Facebook. Let's see. Luis Cardenas Camacho, another great topic, he says. And he makes a comment. Let me see if I can read this. I understand that pharmaceutical companies need to make their money to continue their research. But what I don't get is once they recoup their investment, why do they increase the price instead of reducing the price? Good comment.
Well, and, like all private corporations, they want to get bigger and buy other companies and pay their shareholders more money. And so that is, as he says, the justification for the price and the increase in price. But, pharmaceutical companies, many of them are spending more on advertising and more on administration than they're spending on research and development.
That is another very important point. Can you repeat that one more time?
Well, and there's only 2 countries in the world that allow advertising for drugs, and that's the United States and New Zealand. They are spending more on advertising and more on administration than they're spending on research and development.
Wow. So there seems to be room, may I say, there seems to be room for making things better, but it's going to have to take some advocating, and it's going to have to even the president, right? President Trump, isn't he also on board with this matter, Steve?
He thinks something should be done about it. Yes.
Right. Yeah.
He brought it up in his State of the Union address.
That's right.
Yeah.
I remember something about it, and I get some notices from CMS that they basically reiterating their commitment to do something about this. Just in this brief conversation, I can tell that there's areas, there are room, the advertisement, that Steve is mentioning, that all the money that they use, perhaps, is it necessary? And then the generic versus brand, that's another area, that transparency that there should be and there isn't. So let us talk a little bit more, if you don't mind. Let us move on to the issue of cost. Let me just read something that I picked up from some AARP materials. Again, AARP launched a campaign. AARP launched a campaign. I think, if I remember right, Steve, it was in March. What was it? The 12th, was it? I think it was right. March 12th.
Yes.
That AARP launched the campaign, and it's called Stop RX Greed. That's what it's called. Stop RX Greed. And if you go to Twitter and other social media platforms and just find the hashtag Stop RX Greed, hashtag Stop RX Greed, you will find lots of activity going on social media regarding this important nationwide campaign by AARP. And I'm sure there are other organizations, especially nonprofits, who are joining the effort. Let me just read just a little bit. The U.S. healthcare system spends well over $300 billion a year on prescription drugs, and almost 3/4 of that goes to brand name drugs, even though they make up less than 1 in 8 prescriptions. The escalating costs of pharmaceuticals are driving up healthcare costs and premiums in both the employer and individual market. As a result, too many seniors report splitting pills in half, delaying filling prescriptions, or not filling them at all, and more. It's unfair that Americans pay the highest prescription drug prices in the world, and it's just wrong that many seniors are forced to choose between filling a prescription or buying groceries. How about that?
Well, that's what we're also saying in the ads that we're running on TV. You might see them now. They have people with dollar bills for their heads. They have $50 bills, some of them, and $100 bills, and saying that the pharmaceutical companies don't see us as people. They see us as sources of money. And isn't there something wrong with that picture?
Yeah, it's unbelievable. But I don't know. I really, like Lupe said earlier, I like this campaign because it's pretty straightforward, right, Lupe?
Yes.
It's pretty straightforward. I really hope that this time around the country joins AARP and all the congressmen who are involved in trying to bring about a change in this matter of the cost of prescription drugs. And you who are listening, by radio and who join by Facebook, please take this to heart. Join the movement, if you will. Join the fight. It is a campaign. It's called Stop RX Greed. That's the hashtag.
Yeah, well, things generally are getting quite expensive for people, and there's so many things we're supposed to be doing in life. We have to, pay mortgages so we can buy a home. We're trying to put children through school. We're supposed to save for retirement. It would be nice to have a vacation each year when we're working, if we can afford it. And, this prescription drug thing, if a lot of people take prescription drugs, this has the potential of igniting. And if people will,
national response,
because this is a pocketbook issue. This is money out of your pocket, your own pocket each month. And I know the man I saw who couldn't, afford to get his drugs that day. I bet his children are anteing up. And as Lupe was saying, it's a family issue and not just a senior issue.
It really is. And when you stop to think that what we just heard on Twitter from AARP, that insulin costs have tripled.
Right.
Have tripled in cost. What is the issue? That was developed years and years ago. There's another practice that pharmaceuticals companies like to do, which leads us all to the need for transparency, and that is, even though sometimes patents have expired, they will actually pay. And they call that pay for delay. Other companies to not manufacture
go a little
something.
slower, because wait, did I hear right that insurance companies pay
No, pharmaceuticals.
pharmaceutical companies, pay other smaller perhaps companies that produce generics so that they don't produce
so
them?
that they won't produce them for a length of time.
Yeah.
So that thereby keeping the cost of prescriptions high. But let's put it this way. People of all ages need insulin. I have a niece who's 12, and she's going to need insulin the rest of her life.
Wow.
I have a
Wow.
grandson who needs an EpiPen by his side all the time. EpiPens went from being $100 to being $700 a piece at one
Amazing.
point. And it was only public outcry that brought the price back down again.
Right.
Not to $100, unfortunately, but it brought it down from $700. So if the public joins in, this isn't a crisis waiting to happen. This is a crisis right now.
Yes,
Right.
it's happening
And
now.
It's happening now, and we all have an interest on resolving it and bringing about just compensation. We're not talking about they're not making money. They have a right to make money.
Right.
They're private companies, and they have done a lot of good, as you pointed out, in developing medications that are much needed by the world. But there ought to be a point of what is a just return for what you did.
Right.
And
Yeah.
at what point are you gouging people?
AARP has something they call, David, the RX Price Watch Report. And you can find the results of that on AARP's website, aarp.org. And it's called the RX Price Watch Report. And they found that in 2017, that retail prices of the brand name drugs, not the generics, but the brand name drugs in 2017 went up 8.4% in
Wow.
1 year.
Wow.
That's 4 times the rate of inflation, 4 times as much as
Amazing.
inflation went up.
Amazing.
And a drug that now costs $6,800 a year, $6,800 a year, if it had been limited to the rate of inflation from 2006 until 2017, instead of costing $6,800 a year, it would cost $2,200
Amazing.
a year. Yeah.
So it's way higher than the
going up
rate
much
of
faster
inflation.
than the
Much
cost
faster.
of living.
So here we go again. We are identifying areas that I believe where there's ground, there's room for making this thing better. And I really hope that, again, that the country will understand that this is going on, this campaign is going on, and they join, they contact their congressmen to express their feelings, because if not, it won't get fixed, and it's only going to get worse.
And that's why, David, that AARP has used this window of opportunity after the president raised it in his State of the Union speech to call to initiate this campaign, Stop RX Greed, and we will see proposals come forward in Congress. And at that point, I don't think we'll have to urge people to get involved in the campaign. I
it.
think they will, because we don't have much choice. We don't have enough money.
Right. Let me just give some statistics here again, taken from the AARP materials regarding that campaign. Remember, AARP launched a campaign called Stop RX Greed. There's a hashtag by that name, Stop RX Greed. And there's then the website, aarp.org/RX. aarp.org/RX. You can go there and get more information. And let me just read this. The average Medicare Part D enrollee takes 4.5 drugs per month. The average. Median annual income for Medicare beneficiaries is $26,000 a year. $26,000 a year. Prices for brand name drugs widely used by 50 plus people increased by an average of 8.4% in 2017. That's exactly what Steve was saying. So these are just numbers that, we all are hurt, and I believe that we would agree that this also affects the cost of insurance, and not just prescription drugs, but even premiums for insurance for all of us. Let's kind of move on to the last section of this show, and we'll start it and then finish it in the last segment. But it is part of the campaign. What are we talking about? I know that we identify areas here and there as to where there is room. So let's. I understand that AARP has at least 3 areas.
There's three, and
big areas.
One of them includes what Lupe was talking about. And explain it again, Lupe. Pay for delay.
Well, the pay for delay is just an effort by pharmaceuticals to continue to keep the market to themselves. It's basically what it is, because once you keep a market exclusive, you can dictate the price that you're going to put it on the market for. And so even though some of those medications have their patent has expired and others would be able to then produce a generic drug, there have been arrangements sometimes between them to, I will pay you this X amount of money in order for you not to produce the generic drug yet.
Yes, it may cost the big pharmaceutical company less to pay the generic manufacturer to not produce a generic, so they can continue to make more with their brand name as the only drug for that disease.
Right.
And we think that shouldn't be legal.
Right.
AARP believes that.
And that's possibly especially true of drugs that are kind of the single shot drug that we call. The one where you've got a certain condition that only this drug exists for. Once that drug becomes generic and everybody can produce it, well, then you've lost your exclusivity to market that. And so that's why it's more profitable sometimes to do the pay for delay.
Yes, David. So fixing pay for delay is one part of one of the 3 things we're after.
Good. Let us go on our last break. Stay with us. This is AARP Arizona Hispanic Connection. The subject today, healthcare. Stop the RX greed. We'll be right back.
Hablemos.
educate, celebrate, connect. Arizona Hispanic Connection.
Thank you. Thank you for staying with us. This is AARP Arizona Hispanic Connection. The subject today, healthcare, stop the RX greed. And let me remind you, if you are listening by radio, we really ask you to follow our page. This is very important to us to keep track of how these shows are helping you. And if somebody's out there, actually, because sometimes when you do radio, you don't know who's out there. So Facebook is a very good way for us to know who is listening. Obviously, this is a Facebook Live and eventually becomes a video and stays on the Facebook page for pretty much forever, so to speak. So please help us spread the word about our shows. We have a Spanish show on Tuesdays and this English show on Thursdays. Let's go back to our subject today. Again, Lupe Solis and Steve Jennings are our special guests on this important matter. So I realize that there are several, things being discussed, several things on the table. And I know one of them is allowing Medicare to negotiate prescription prices. I understand that Medicaid already is allowed, but not Medicare, Steve?
Yes, that's right. Access, in Arizona we call Medicaid access. And private companies like United Healthcare and government entities like the Veterans Administration and even other countries negotiate with these giant, as Lupe was saying, multinational drug manufacturers. And they say, well, we have 40 million people, and if you don't give us a better price on your drug for this 40 million people, then we'll get a generic from somewhere else. And they're able to cut deals with these manufacturers, and it's substantially cheaper in those to get the drugs. And so it's a complicated business, but that's kind of putting it simply. So Congress passed a law that said Medicare was not allowed to do that. There's 40 million people on Medicare.
And I mean, was there
now,
a reaction?
Does that make any sense?
Was there a reaction by the country when? Do you remember?
Well, it was
when
done
that
kind of
happened?
quietly, and Medicare never has negotiated.
It was a last-minute change, and people, I think, were pretty much caught unaware. The advocates, in particular. So by the time we caught it, it was a done deal.
Wow.
And they've kept it up all these years. They do not allow negotiation.
So let me grasp this a little better. So you're saying that Medicaid access, for example, in Arizona, because they have so many people enrolled in their plans, they're able. The state has the capacity to negotiate prices. And
nationally, right? Medicaid can negotiate drug prices and get the drugs substantially cheaper. And the veterans do that. Other countries do that. That is probably the biggest single change that would, help the most, people on Medicare, at least, the 40-some million people on Medicare.
Do the insurance companies, say group insurance, do they also have that kind of power to negotiate?
Right. The big insurance plans, they use things called pharmaceutical benefit managers. And, at one point I had a man from United Healthcare telling me that he was claiming they insure upwards of 30% of the people in the entire country. So if you think, we have how many people in this country? 330 million. If they have a third of them, think of the ability to negotiate they would have.
So in this sense, access, it's
like, you don't give me a break, I won't buy your drug for 100 million people.
Got it.
That
so
need
the more the insurer has, the more people, the more the power they
get. Or
the
entity, the Medicare entity. Or Medicaid or the veterans.
Okay.
And remember, access is a state-administered program. Medicaid programs are administered by each state separately. Therefore, they have the ability to bundle services. And by that, I mean, all kinds of hospital medical care and prescription coverage. And that gives them the ability to control a little better their costs. if Medicare was able to do this, we would see a huge savings in the cost of the program, which is direly needed because Medicare is going to need some reform.
So now let me ask a quick question. Do we find the same, complaint by non-Medicare people about the cost of prescription drug, or is mainly the Medicare group?
Well, people on Medicare are paying the highest prescription drug prices in the world.
People on Medicare, and I assume that that's precisely because Medicare is not allowed to negotiate. Is that I would say that would, at least it would help.
That's a big part of it.
So
yes.
Insurance companies on the group insurance business, they negotiate. Medicaid in the states negotiate the cost of prescription drugs for the people they insured, but not Medicare.
Yes, and in a poll that AARP did just this year, a national poll with over 1,200 people, 90% of the people that we asked in the poll said they supported Medicare being able to negotiate for lower drug prices. 90%.
And you have to realize that for people that are not on Medicare, for example, given the high cost of insurance premiums, which sometimes have not only the high co-pays, but the, what is that called? The payment that you have to do up front.
The deductibles?
The deductibles are very high, very high. That means you're buying your prescriptions pretty much out of pocket.
So basically, we might not feel the pain in the actual cost of prescription, but they're including those costs in deductibles and co-payments
in the overall
and
cost of
co-insurance.
health insurance.
Amazing.
Of course it is.
Okay, so kind of like to summarize, there is a lack of transparency. We would love to see more transparency. There is.
What do you mean by that, David?
The transparency of the insurance, the pharmaceuticals, that they're not revealing pretty much anything about how much it costs
well,
them.
if they do a dramatic price increase, like this man that raised the price of the EpiPen, I don't know if you remember that one, several times, that they should have to report to someone,
right,
the reasons they're doing that, so we can determine if it's a valid reason to do it and it's necessary, because these drugs are necessary for people. They are
right,
not optional things.
They're not optional. This is very,
Life-saving.
very important. So again, given Medicare negotiating authority to negotiate prices just like Medicaid has it, then the issue with generic drugs being available sooner.
No pay for delay.
Right. That would be another huge item. How about the issue of caps? Do you think that's, because I believe that's in the AARP area, or one of the areas that AARP has included, and that is putting caps on the out-of-pocket cost. It says here that Medicare Part D prescription drug program makes medications more affordable for millions of seniors. 1 in 10 Part D enrollees with high out-of-pocket costs spend at least $5,200 a year on their medicines. Many of these seniors have chronic conditions, meaning they are facing this high cost for the rest of their lives. This forces many to choose between food and other necessities and medicine. AARP urges Congress to pass legislation that would help seniors with high drug costs by capping their out-of-pocket costs.
Well, if they're spending $5,200 a year, many seniors are, that's $100 a week. And if people have a $26,000, mean income for people on Social Security, and some of these drugs are tremendously expensive, like Lupe was saying, what shouldn't there be a limit that people have to spend on drugs? Can't you limit that with a cap? Because obviously this line we use that people shouldn't have to choose between food and medicine that isn't optional.
Right.
That's what people are running into.
Amazing.
So yes, AARP supports there being a limit or a cap on out-of-pocket spending on prescription drugs. We want to see Congress enact that too.
That's true, and it's not only needed for the individual, but as a whole for the program. We must sustain the financial feasibility of Medicare, and that would be one way to tackle it. The other thing is that I believe that in 2015, Medicare enrollees paid $27 billion in out-of-pocket expenses. That is, that's the GPA of some small country.
And remember, David, that, between 2007 and 2015, the spending on prescription drugs, with Medicare, more than doubled from $11 billion to $26 billion a year.
Crazy.
So this isn't optional. This is not just, this is a situation we need to do something about. This is a situation, a problem that's
It's
getting
critical.
bigger each
It's
and every
critical.
day.
Yeah.
The time to act is now, and I think, in my view, AARP has entered these at just the right time. People are concerned, but there's also been some attention from Congress on this issue, and it's high time we tackled it.
Yeah,
High
definitely.
time.
Well, let me let the audience know that there is a hashtag. It's called StopRxGreed. There is a hashtag called StopRxGreed. Also, if you would like to go to our website, aarp.org/RX, aarp.org/RX. And we really need folks to join. Any other way, Steve, that you see that folks can join this effort?
Well, at this point, go to aarp.org and take a look at our Stop RX Greed campaign and see the various parts of it. See the ads we're putting on TV. See, we're doing social media advertising to people through Facebook and Twitter. We're doing radio and television. It's a full-out campaign, and you'll watch it pick up momentum. Talk to your congressperson, of course, about the cost of drugs, and stay tuned on this because there's more to come.
Any final thoughts, Lupe?
No, just people don't wait to get involved. This is something that could be resolved, and I think we are very grateful for AARP's leadership in this proposal, and we need to join in. That's all there is to it. If you stay silent, you're part of the problem.
Definitely. So we invite all of you to again visit AARP Arizona, AARP.org/RX, AARP.org/RX. The hashtag is StopRxGreed. And the last thing I would like to ask you once again is please help us to spread the word about these shows. This is a radio show in English on Thursdays, in Spanish on Tuesdays. We address similar issues, and we really depend on you and spreading the word to your friends and families. Thank you very, very much for joining today. The subject was healthcare. Stop the RX greed, and we will continue with these efforts. We will join the campaign, and we will see you next week. Have a great day.